Welcome to ACC.13. You know, we're celebrating the 10th year anniversary, really, of the development of the Cardiac Care Associate membership. So I'm thrilled to be joined by three people that are responsible for this and also were there at the development of this. So introducing first Eileen Handberg. Eileen, good to have you here. Thank you. And next, we have Margot Manessian. Is that right, Margot?
Yes,
that's great. Good to see you.
Thank you.
Not last and not least is Michael Clark. Michael, glad to see you. Thank you very much. Eileen, let me start with you because I think, you know, you were really instrumental in the development of this category of membership. Tell me a little bit about why you did it and how it came to be.
Well, the college, I think, was very insightful in understanding that there is a workforce shortage for cardiovascular medicine, and we're very understanding that in their normal daily practice, the cardiologists who are members of the ACC worked in teams.
Sure.
And so it was a very natural progression to expand the membership of the college to include members of that team, nurses, nurse practitioners, clinical specialists, physician assistants, that they had work with every day in the hospital. And so we have common educational needs, patient care needs, and so the college opened up that membership to those categories to bring the team together in a professional way, and so it enhances the education and opportunity for all members of the team.
I mean, it's tremendously valuable. I mean, obviously we can't function without nurses and PAs and everybody, and
right.
And I think that's a great concept. Michael, speaking of PAs, so you've seen this evolve over 10 years, and from the physician's assistant standpoint, why is this important?
Well, you know, I think one of the most important things is, and you know, especially for me, being a PA for a while, is that PAs are trained socio-philosophically as team members.
Right.
It's a team-based type of practice process. The CCA categorization, member categorization, was an important step with the college to help incorporate those team members into the family of cardiovascular medicine.
Absolutely.
For me as a PA, clinically, it's a very important step to have that particular relationship and that opportunity with this organization.
I mean, I agree with you. Do a lot of the PAs that now practice, have you seen really an evolution so that now more of them are sort of getting active in this category of membership?
Absolutely. If you look at PAs in general, specialty areas of practice seems to be the largest area of growth, and especially in cardiovascular medicine.
That's super. Margot, let me ask you, because there's something I quite honestly wasn't aware of, and that's that you were active in the sort of the formation of the Cardiovascular Team Council, that then morphed into section. Tell me a little bit about that.
Yes, absolutely. So to help meet the needs of the college with the ideation that we would be moving towards team-based care,
right.
The formation of the Cardiovascular Team Council, and then therefore the section were developed. And so essentially anyone can become a member of the cardiovascular team section. As a matter of fact, that's our goal, is that every physician, every nurse, every pharmacist, and every physician assistant would be a member of our section. Because as Eileen very nicely stated, we're all team members,
right.
and we all function within that realm. So it was very natural, it was a priori to have that transition into the section.
It's interesting, so this is open to any member of the college.
Yes.
Is that correct, to become
Yes.
part of that?
FACCs who are members. We had our meeting last night, and it represents the entire
it's
team.
Great.
Yes.
It's great.
Yes.
Let me, Margot, I wanted to ask you about the AAC designation. Tell me a little bit about that.
Yes, exactly. So the designation of the Associate of the American College of Cardiology emulates the FACC, the fellowship category.
Right.
And so what this represents is national board certification amongst cardiovascular professionals that otherwise wouldn't sit for a cardiology board exam.
Sure.
So it allows other professionals, such as physicians and other types of physicians in other societies, when they see an AACC behind a cardiovascular team member's name, they understand that that's national board certification, and that's a specialty in cardiovascular care.
That's cool.
And our inception was 2010, and it was a highlight of my career to walk in convocation at the 60th anniversary, and they received a standing ovation, and it was wonderful.
That's great. Well,
it still is.
Just in summary then, Michael, if you look back over the 10 years, and same thing to you, Eileen, what are you most proud about of this CCA membership category as you think about it?
I think one of the key things, having been involved with it, is how we have grown and how we have started to stand out as a model which represents the team-based practice for cardiovascular medicine. If you look at the healthcare needs, especially cardiovascular healthcare needs across the country, it's going to take a team-based practice to help meet those needs. I think ACC, the college, has made a very important step in helping understand that, as well as to help perpetuate that culture of understanding what that is and what it takes to provide that care.
Eileen?
I think actually the most important thing, and what people probably don't realize, is that the members of the team are incorporated in every committee structure of the college, including the Board of Trustees. And so that this wasn't something done in name only, that the cardiovascular team is integrated throughout the college and has a voice in how the college is going to address cardiovascular care across the world. And I think that is just representative of how important a team is in cardiovascular medicine.
Well, I certainly appreciate the three of you getting this started, and I think you're dead on that this is an absolute critical aspect, because we do practice as a team, and it's going to be important in the future to really meet those needs. So thanks for joining me. I've really enjoyed learning about it and more, and thank you very much for doing it. And thank you for joining us. We'll have more for you from ACC 13.